Well, I think the first message is that we can actually improve a lot and do better with the outcomes for our babies simply by doing better with what we already know. Because there's a lot of room for improvement in terms of using the knowledge that we have. And I think we've demonstrated that in many ways, and I think many people can benefit from that. That's the first thing. The second thing is that there's some very simple things we can do that actually have a huge impact. Necrotizing enterocolitis is one of those things. And it's as simple as ensuring that we give human milk instead of infant formula, and to feed them properly. In other words, feed them faster than what we were doing previously because we were afraid that feeding fast would cause neck. So we found that a combination of using just using human milk and aggressive feeding or feeding them fast actually decreased neck, to a very low level. So those are very simple things that we can do that have huge impact. The third thing is that we need to embrace and empower our families more. And we need to stop thinking of them as just patients. In fact, they are also part of the care team. They bring a lot of wealth of information, of expertise, of capabilities, and consistency of care that we will not get if we do not engage them as caregivers of their own health as well as their baby's health. So I think that we need to rethink our model of care, of thinking of patients as patients and caregivers as being just health professionals. We need to see how we can bring them into the care circle.
So continuing on that theme of family integrated care, I guess you've seen amazing and positive results, but what's the greatest challenge to actually integrating family care into your NICU or into other NICUs that are interested in moving into this model?
Yes. I think the biggest challenge is actually changing the attitudes and beliefs of the healthcare givers. People just don't believe that parents can do so many things. And yet when we give them the opportunity, they learn really fast and become really good at it. So it's changing that belief. And once people realize that it can be done and that it's a good thing, then people will embrace it.
And you also spoke a lot about changing in feeding practices that you've observed within Canada and in different countries. How would you hope to see human milk feeding change in the future? What would your ultimate goal be?
Well, I think that we should have 100% human milk feeding, either mother's own milk or donor milk if the mothers cannot produce milk. I think that if we were a lot more aggressive, a lot more energetic, shall we say, about promoting breastfeeding, and we gave mothers more support, and we gave them the people who can help them to succeed, and give them the conditions to succeed, social policies, etc., that we will be able to achieve a very high level of breastfeeding. And if we do that, I think we'll make a huge difference. So, I think it's moving all those things together.
Yeah. Okay. Thank you very much for your time today.
Thank you.